Hello, everyone. Dr. Laura Fenimore here from the University of Pittsburgh. I have the pleasure today of interviewing one of our former CRNA students, Derek Schmack. Derek is a nurse anesthetist at the Vanderbilt University Medical Center in Nashville, Tennessee. And I'm delighted that Derek was able to join us today. And we'll talk a little bit about why he chose anesthesia, why he chose this particular route as an advanced practice nurse. And so without further ado, I'd like to introduce Derek. Derek,
Hi,
tell us
everybody.
a little
How's it
bit
going?
great. Tell us a little bit about your current role and the scope of practice in that role.
So I'm a CRNA at a tertiary care facility, very similar to what you guys would recognize as UPMC Presbyterian. It's a large hospital. It's a teaching hospital. And my role at the hospital is to function as a CRNA. So usually what we do in this setting is work in what we call an anesthesia care team model. So we work in collaboration with anesthesiologists. But I would say that generally we meet a patient, we discuss with surgeons what their problem is, and we diagnose or prescribe an anesthetic plan for the patient. Usually we meet them the day of surgery. And from that point, we develop our plan and take care of them from the point of picking them up in pre-op all the way through the operation to care for them during surgery, performing all types of patient care. And then we see them through to the post-op period, and we hand them off to the PACU nurse or maybe an ICU unit or wherever their destination may be after the OR. So we have an acute spectrum of care. But any more specifics you'd like me to go into?
So are you involved with the delivery of the medications for putting patients to sleep? What's that like?
Yeah, so I would say that our role is very hands-on. We do a variety of procedures and prescribe and deliver medications. So generally, we'll give a patient some medicine before surgery to help ease their anxiety, maybe some midazolam or Precedex. So that's usually the first drug interaction that we have. And then once we get back into the OR, we're usually doing things like administering antibiotics before surgery and administering medications that will induce somebody to go to sleep under anesthesia. There's a lot of different drugs that we give while you're under to prevent you from getting sick. We administer and control anesthetic gases. We administer drugs to control your heart rate and blood pressure, your pain and your state of awareness. And so we control you going off to sleep throughout the procedure. And then when you wake up, a lot of times they use the metaphor of it's similar to being a pilot, takeoff, cruise control, and landing. One other important thing might be to point out are the other techniques that CRNAs can do. Depending on what state you're in, a lot of times there are other methods of anesthesia you can do or other ways you can care for people. For example, sometimes we manage chronic pain by doing pain intervention with different nerve blocks or steroid injections. And sometimes we manage chronic pain or other symptoms through doing ketamine infusion clinics.
It's very interesting. So why anesthesia? How did you pick nurse anesthesia as your career choice?
Yeah, so I would say when I was a nursing student right down the road in Pittsburgh proper at Duquesne University, I had the opportunity to come back and shadow a fraternity brother who is about a decade older than me. And he works at the University of Pittsburgh. And also, so at that point, I got to come shadow him in the OR. And before that, I think that I mostly wanted to do travel nursing and just explore the country. And after getting to spend, 8 hours with Sean Weber, who's a CRNA at University of Pittsburgh, I really got to see the autonomy that nurse anesthetists had. And I was blown away with the personalized care that Sean was able to deliver for the patient. you really, it's the most autonomous role that I think you can take on, or one of the most autonomous roles you can take on as a nurse, because you're the advocate for the patient when they're asleep or unable to care for themselves. So minor things of just making sure that they're in the right position and that they're comfortable during surgery, making sure that you're easing their anxieties as they go off to sleep, and waking them up in a calm, soothing environment. I was really blown away with how much you can care for a single person. So you're definitely there, keeping them alive under anesthesia. And I love the way that you can focus your energy onto one patient at one time and deliver them the best care possible. So I think having that experience, saying that, really drove me towards anesthesia as a profession.
And what did you have to do to get ready to be a nurse anesthetist or to enroll in a program for a CRNA?
So I would say for people that are interested in being a CRNA, if you think you're interested, the first step is to go shadow. That's the first step of preparation, is deciding, is this for me or is this not for me? Because it's definitely a commitment to go back to school, and you're choosing a career for a lifetime. So that's probably the first thing I did to prep, is I shadowed a few different CRNAs to make sure that that was what I wanted to do. And so from that point, you have to look at different requirements to get back into CRNA school. So for example, the American Association of Nurse Anesthetists has nurses go back for a requirement of a minimum of 1 year in a critical care setting. So my journey goes as I applied to different critical care units across the states, because I definitely wanted to get a little bit of that travel experience in, or see different areas in the country. So I was a critical care nurse down in Florida for 3 years. And I really do think that your experience as a critical care nurse, or a nurse in any manner, really prepares you for anesthesia school. So I grew up really quick. Being a 22-year-old in a critical care setting makes you mature very fast. You're dealing with critical situations, complex family dynamics, and, to be frank, death and dying. So you don't see a lot of that as a young person. So I feel like, compared to my peers, maybe my perspective had shifted quite a bit. But what it did strengthen was my ability to have critical conversations, think critically, and handle complex pathophysiological diseases or situations. It taught me how to titrate all the medications that I would be using in the future, how to use some of the sedating drugs that I would be using in the future, and most importantly, how to collaborate interprofessionally and communicate. I think that's the biggest thing that I learned with peers and family members and patients.
Cool. Well, what made you choose Pitt?
So going back to Pitt, after that journey, I definitely sat down, listed out the schools. I had such a great experience of nursing, and I attribute that to, one, Duquesne, but also the city of Pittsburgh, and being associated with major medical centers. So I did my due diligence and talked to other CRNAs, and Pitt came highly recommended via word of mouth. I knew I was comfortable with the city. They have world-renowned faculty. They have also some experiences that are unique to the program. They integrate simulation early and often into their program.
Yeah, tell us about simulation. What's that like?
Oh yeah, so I forget if you guys have had any exposure to SimMan in your nursing curriculum. I believe you do. Maybe.
They will.
So situations like you're using SimMan, which is an interactive mannequin. I hope that's the proper terminology, but to walk you through different clinical scenarios for when you go to the OR. So there's a few examples that stand out, like skills of putting in arterial lines, central lines, and doing epidurals and spinals stand out. But the one that really stands out to making me successful is going through the process of inducing somebody under anesthesia. So they would set up the room like it was an operating room, and SimMan would be your patient, and you would have peers function in other roles. And we would just repeat over and over and over again the process of induction, which was great because it gave you this foundation. The first time I was in the OR, I felt a bit more comfortable in knowing the steps to walk through in an intimidating live environment. Mm-hmm. So I really fell back to my simulation skills of putting a patient to sleep, mass ventilating them, intubating them, and getting their anesthetic up and running. I think that was quite invaluable to the program.
That sounds really fun. It also sounds like it helped prepare you. How prepared did you feel when you finished our program? What was that like to be a brand new CRNA?
Well, I would say that I felt quite confident. I felt that I was sought out after as a Pitt graduate. I certainly felt like when I was going to interview for jobs, it was me interviewing for a fit with the employer rather than vice versa as a nurse. So it felt good to have that chip on your side. I definitely felt prepared. I would say the biggest learning curve in my nursing journey has been going from nursing school to critical care. I think Pitt did an excellent job in reducing the steepness of the learning curve of being a CRNA when I graduated. So yes, it was a new environment. There were some new tools, but ultimately I felt very prepared.
Excellent. So while you were in the program, you did a scholarly project. Tell us about your project. What was that about?
Yeah, so my project was creating actually a simulation course. I did it in collaboration with some of the faculty there, Dr. Michael Neft and Dr. John O'Donnell. And I had one other colleague that worked with me, Brian O'Connell, and we had two separate projects that kind of focused on the same, it's focused on difficult airway management via simulation. So what we did was we took an outdated program that was an early simulation difficult airway course, and we rebranded it with new learning methods and streamlined the efficiency of the class and kept it effective. So it was a quality improvement project, and that was completed down at Weiser. I think all the Pitt students get some exposure at Weiser as well. So we got to work with Dr. Frampus. And I would say that is something from my learning that I've been able to carry on as I've gotten involved more with my division down at Vanderbilt. I've been able to step in and help in different roles for quality improvement projects, not necessarily because of the simulation, but going through the process of a DMP project where you're working on different things for quality improvement in any setting. I would say that it's translatable.
Well, as a faculty member, that does my little heart good to hear that you're absolutely able to continue that work that you spent so much of your time and energy working on as a student. What's a typical day look like for you?
Typical day. Well, fortunately, I'm still walking distance to the hospital in an apartment, so I get to roll out of bed, maybe go for a run or work out, and then I stroll to the hospital. I usually get to the hospital and I'll go to my locker, walk into my OR. I'll set up my room to make sure that my anesthesia machine's working. I'll swing by pharmacy to grab any controlled substances that I'll need for the day or any miscellaneous medicines. Usually grab a cup of coffee in between there. If I haven't looked up my patient the night before, I'll take about 10 minutes to do a chart review. And go introduce myself to the patient. It's going to be the start of the day. Discuss their health with them, what I found in their chart, discuss the anesthesia plan. At some point, I usually will touch base then with the surgeon and the anesthesiologist to make sure we're all congruent in our plan and what's going to take place for this patient. And boy, at that point, once you hand off with the pre-op nurse, you're taking care of the patient the rest of the way. So you wheel them back to the OR. Go ahead and perform a few surgeries. Kind of repeat that cycle throughout the day.
How many cases do you do on a typical day?
Yeah, so there's a variety of different shifts in different areas in the hospital that you can work. So, for example, yesterday I actually worked a 16-hour shift. Um, so I think I did about 6 cases, and those are always interesting days, the longer days, because you usually are switching divisions or care settings within the OR, so different service lines. So let's see, yesterday I did two orthopedic surgeries. I did a gynecologic surgery. Um, and then finish the day up with I believe 2 ENT surgeries. So switching service lines throughout the day sometimes can be a challenge, but sometimes you're just in a single room doing maybe cataracts for a few hours. So if it's a short procedure, maybe you're doing 11. Sometimes you could be doing an open heart surgery that could last 3 to 4 hours.
That's helpful. That gives, a perspective on what the typical life of a CRNA is like in the work setting. What are you most proud of so far in your career as a CRNA?
Most proud of. Most proud of on my personal journey has also kind of goes back to Pitt. It's having the opportunity with Dr. Richard Hanker to go abroad and gain some experience in both Siem Reap, Cambodia, and Luang Prabang, Laos, delivering anesthesia internationally, and more importantly, learning anesthesia internationally and seeing how CRNAs in developing countries or low middle resourcing countries conduct their anesthesia. I believe it made me a better practitioner. So I'm proud I was able to gain that perspective and participate in that. And then I think most importantly is getting through school and being able to pay it forward. It's great to work with like distant family or friends that are going into nursing and be an advocate for nursing as a whole, not just nurse anesthesia, but what a great profession nursing has been, how rewarding it's been, how diverse and dynamic of a profession it is. So I think paying it forward and getting people involved with nursing has been probably the most proud moment.
That is awesome. So in closing, do you have any last minute advice? I know you suggested that students shadow and check it out, but what word of advice would you give a brand new student?
A brand new student. Enjoy your experience being away from home. You just got to show up. That's probably the best advice. It doesn't matter what you feel like in the morning or what you did the night before. Make sure you go to class, get good grades, enjoy yourself on the weekends, and enjoy life as you move forward. Work extremely hard, and it'll pay off for you. If you know you want to, go into anesthesia, keep your pedal to the metal. Take your GREs as soon as you graduate, seek out critical care opportunities as externships while you're in your undergraduate BSN program, and don't take no for an answer. Keep going.
Awesome. Derek, thank you so much for, first of all, doing this after having worked a very long shift. And I know it's early in the morning for you. So thank you again. I think your words of wisdom will be a real inspiration to our students and for nurses who are considering being a CRNA in the future. So thank you so much. You're a great representative of the University of Pittsburgh, and we're grateful to you for your help.
Thank you for having me.
You're welcome.